So that early diagnosis is a really protective factor for children diagnosed with FASDs. It leads to effective and appropriate interventions. In terms of those effective interventions, we know that people pre-diagnosis, only about 10% are accessing disability income supports compared to those post-diagnosis, about 90% accessing disability income support. Pre-diagnosis, just disability supports in general, about 15% accessing those. Post-diagnosis, it soars to 85%. So it's really crucial. And what that diagnosis and intervention can offer is a more meaningful understanding of the person. Remember, you know, every person with FASD or fetal alcohol spectrum disorders has a unique presentation. Depending on when alcohol was consumed and how much, it can affect different aspects of a person's functioning. So understanding that person's unique profile is crucial. Understanding that child's unique profile is crucial. One person with a FASD could look very different from another. And that's led to a lot of the difficulties that we have in identifying and diagnosing FASDs in children. So a really thorough assessment can help develop our understanding of that child, their unique strengths, the areas where they need greater support, and can help us identify the correct or the most appropriate, most helpful interventions, including medications sometimes. It can also help them access funding and early intervention services. It radically improves long-term outcomes. And importantly, it can provide some relief, confirmation, validation for the child, the young person, their carers, their family care network. Look, there is no cure for FASD. It is a permanent, lifelong brain injury and body injury. And individuals with a diagnosis of FASD will need appropriate supports across their lifespan. Improvement is possible, but progress can be slow and with limits depending on the extent of the initial brain injury. There is no single intervention or technique possible due to the diversity of the presentations and the differences in the underlying issues, which just reminds us how important it is to really have a good understanding of that person's unique profile, their unique functioning. Interventions should target the whole family and support system, not just the child. They've got to fit that brain and that unique character of that individual child, and their family and support system.